Hi, I'm Dr. Dean Mitchell, and I want to welcome you to the Immunologist series. I'm a clinical immunologist and also a holistic practitioner in New York City. Today's topic in the Immunologist series is, what should you do if you get the flu? The flu virus now is going rampant around the United States, especially here in New York, where so many people are being affected. I saw doctors and nurses even have come to my office. And in fact, unfortunately, my own father, 81 years old, just recently contracted the flu. And fortunately, we took some measures to get him on the road to recovery. He's a person who works 5 days a week at 81 years old, is still going strong, so we wanted to help him recover as soon as possible. So how do you know if you have the flu? The typical flu symptoms are sometimes similar to a regular virus. The symptoms such as a sore throat, a cough, as well as high fevers. Now, a high fever more than 101 degrees is something you want to watch out for, especially after a day or two, because that could be more indicating that the flu is happening to you. The other issue, of course, is muscle aches as well. So how do you get diagnosed with the flu? It's very important that you see your doctor, so this way they assess if you do have the symptoms that are consistent with the flu. The other way, which is also extremely important, if possible, is to get the rapid nasal flu test. This is where a swab is put into the nose, swirled around, and then put into a test kit where they can know within minutes whether you've been exposed to the flu. The different types of flu that exist are actually, there are 3 types of type A flu, and there's also one type B flu. Now this year in particular, we're having a difficult time with the flu because it's what's called the H3N2 virus, which is very similar to the old Hong Kong flu that was around about 20 years ago. It's causing a lot of problems, a lot of people are getting sick, and it's harder to recover. What's very important in the treatment, and what I did for my father, is that to immediately, once the flu is diagnosed, is to use a medication called Tamiflu. Tamiflu is an antiviral medication which, if started within 72 hours of you contracting the flu, can help ameliorate and decrease the symptoms. This is also available for children as well. So again, I highly recommend that if you believe someone in your family has the flu, that this is used as soon as possible. The holistic things that we recommend for patients that get the flu seem like grandma's advice, but they're really worth it. One is obviously to rest and avoid contact with other people. In fact, you should ask your boss to pay you double to stay at home, because if you go with the flu back to work too early and you give it to other people, you're just spreading the contagion of the virus. The other thing that's extremely important for you to recover earlier is to hydrate. By taking in fluids, especially soups that have salt in it or teas, you're hydrating your body, and this way your immune system can work better and more effectively. The other thing is to eat lighter meals. Now, of course, you'll say, well, don't I need to eat to have my energy? Well, when your body is battling a virus, it's really important that the immune system is not weighed down and using too much of its energy in digesting your food. So eating light, again with soups, is fine. Antipyretics, things like Advil and Tylenol, are okay to use, and especially if your fever is over 101 or 102. But if you're running just a low-grade fever, it's actually better to not take those medications, because your body's immune system works better under a slight fever to help mobilize the forces to beat the flu. Now, what about antibiotics? Of course, patients typically think, oh, I need an antibiotic. Well, it's actually a bad thing to do, because it's not going to help fight the flu virus or any other virus for that sake. If, however, you're seen later on you have complications from the flu, like a pneumonia, which is more dangerous, that's when your doctor is going to want to use antibiotics. And finally, vitamins. What's the role of vitamins in the flu? Well, if you've been taking vitamins like vitamin C all along, let's say 500 or 1,000 milligrams, it's good to increase your vitamin C intake, possibly up to 3 or 4 grams, because this is going to help you fight the infection. If you haven't been taking vitamins before all this, just starting them at the time of the flu is probably not going to make a difference. I hope you found this information valuable. This is the beginning of the Immunologist series, and I hope if you do enjoy this that you will look out for our book called Immunologist that's coming out this year. Thank you.